This short presentation accompanies the key to the antibiotic charts. In the aminoglycoside class, gentamicin is our drug that we're discussing today. It is used to treat gram-negative bacteria in serious infections and can be used prior to the culture and sensitivity results. It comes in several ways of delivery: ophthalmic, topical, IVIM, and intrathecal. The black box warning is for nephrotoxicity and ototoxicity, meaning you need to increase hydration, look at urine labs, and tell the patient to let you know if they have any hearing loss. In the carbenims, we have ertapenem. It treats gram and negative bacteria. Note that the adverse effect is GI toxicity or GI limiting, meaning that you need to discontinue the drug if the patient develops a super infection such as C. difficile diarrhea. You need to monitor for these GI effects and avoid use in individuals that are under 18 years of age. Vancomycin is also used for gram-positive staph, C. diff infections in the oral method of delivery of vancomycin, and is used for MRSA resistant infections. Renal toxicity, acute kidney injury, ototoxicity are also adverse effects of this drug, as in other drugs. You need to monitor for red man syndrome, and this is a drug that's usually dosed by the trough level. So patients will definitely have a trough level and sometimes a peak and a trough level drawn. Be sure that if the trough is ordered, not to hang that antibiotic until you have made sure that the trough was drawn and that you get the results back. There are several generations of cephalosporins. The third generation and the fourth generation drugs are more expensive than the first and second generations. Ceftriaxone is the drug that we're talking about today. It treats a wide range of bacteria, including gram-positive and negative bacteria, and also has nephrotoxicity and superinfections as adverse effect. The GI limiting or GI toxic effect of this drug is colitis or bloody diarrhea. So for that reason, the drug would be discontinued. Note that the risk of bleeding increases if you use this drug with an anticoagulant. So you would have to monitor the anticoagulant labs more frequently and adjust those doses. Fluoroquinolones are also broad-spectrum antibiotics used for UTIs and respiratory tract infections, anthrax, and typhoid fever. The black box warning here is for tendinitis. Tendon rupture is possible, particularly if you are over 60 years of age, and typically that tendon rupture would be the Achilles tendon. The GI side effect you have to be sure to teach your patients about is photosensitivity if the patient is going to be out in the sun. In the penicillins, all the penicillins must be taken on an empty stomach, except amoxicillin, which can be taken with food. The GI limitations are diarrhea and stomatitis, superinfections, pain at the IV site, and anaphylaxis. A lot of individuals are particularly allergic to the penicillin class of drugs. In the sulfonamide class, the cotrimoxazole is given to patients with gram-positive and gram-negative bacteria, particularly urinary tract infections and sexually transmitted diseases. In the renal category of adverse effects, decreasing filtration leads to nephrotic syndrome, which is a serious renal condition for patients, and inhibits their ability to filter proteins and electrolytes. This combination drug helps to reduce bacterial resistance to the drug, but the drug does interact with a lot of drugs. Please note the cross-sensitivity with thiazide diuretics and the increase in potassium levels with some drugs. Doxycycline is the tetracycline. The main problem that individuals have with this is pitting of bones, which leads to osteoporosis, and increased risk of fracture. And the staining of teeth, particularly in children that are younger than 8. Pregnant and lactating women should not take the tetracyclines, particularly for that staining of teeth effect that will happen with the individual secondary teeth their permanent teeth. It does decrease the effectiveness of oral contraceptives, so patients should be warned to use more than one type of birth control if they are on oral contraceptives while they're taking the antibiotics. Isoniazid, the thing you need to worry about with this drug with your patients is tyramine foods, and we've already talked about those, and I've listed them here. You need to give the patient a vitamin B6 to prevent neuropathy, so you give it for overdose, but also individuals usually take vitamin B6 during isoniazid treatment. Given in combination with this drug is rifampin for tuberculosis as well. It is administered on an empty stomach, and it tends to turn body fluids reddish orange, and soft contact lenses will be permanently discolored. Again, they interfere with oral contraceptives, and the other problem with these drugs is they need to be taken 6 months to 2 years to complete the course of treatment. Clindamycin is used for severe infections, and again, bone marrow suppression, pseudomembranous colitis is a definite problem with this drug, and for that GI effect, you may need to limit or decrease the drug or remove the drug and change to something else. Again, it is limited in use because of its severe toxicity issues. In the macrolide department, the erythromycin and azithromycin that we are talking about in this chapter are also GI limiting or GI toxic and can cause C. difficile and hearing loss, as well as other super infections. All these drugs are taken on an empty stomach and need to be avoided in lactating women because they are also secreted in the breast milk. Linezolid is also known for its adverse effect of pseudomembranous colitis and can cause thrombocytopenia. It should not be used within 14 days of an MAOI inhibitor, and tyramine foods should be avoided with this drug as well. In the viral category, rimantadine is used for influenza A and is a preventative of influenza A in children. Treatment must begin with symptoms less than 2 days to be effective, and it will not completely eradicate the viral replication, but it does inhibit it to limit the symptoms so that you will start feeling better several days sooner than you would have with no treatment. Acyclovir and valacyclovir are used for herpes simplex, shingles, chickenpox, genital herpes, cold sore type of viral infections, and it comes in several forms, oral, IV, and topical. Need to wear gloves when administering the topical, and we've talked about using gloves to administer meds before, so those same restrictions apply here. Zivindudine is used for HIV. There are many HIV drugs, and several of them are talked about in your textbook, but this is the one we've chosen as a common antiviral for HIV. It does cause hepatomegaly and pancreatitis, so you need to monitor hepatic and renal function, and is often given in combination with other drugs. The antifungals is fluconazole, is our drug that we're exemplaring this semester. It is used for fungal infections, and patients also develop diarrhea, but the big problem with this drug is hepatotoxicity and a dermatological condition called Stevens-Johnson syndrome. It is given oral and IV and has many drug interactions, and I've listed some of those there for you to look at. So that would imply that these drugs are important to be aware of, and if your patient is on a combination of these drugs, their monitoring of drug levels, particularly for DIG, for oral and insulin hypoglycemics, and phenytoin, warfarin, and anticoagulants. You must monitor those levels. Finally, with metronidazole. It is used for protozoal infections. It is used pre-op and post-op for prophylaxis colorectal surgery, but particularly is used in combination with antibiotics to treat H. pylori ulcers. So remember that use with H. pylori as one of the combination drugs. It does darken the urine, as do some of the other drugs, but you need to particularly avoid alcohol within 3 days because it will cause disulfiram reactions, and I've listed the symptoms of a disulfiram reaction, which is almost like alcohol withdrawal. This drug also increases bleeding with oral anticoagulants, and you need to monitor the liver function. For all of these antibiotics and reactions, you need to know what you're looking for the individual antibiotic or antiviral or antifungal, antiprotozoal, and when should that client notify their healthcare provider that they are having an adverse reaction. Thank you.